HBWC Nation. My name is Minister Tawana Cummings, and tonight we have a very special event for you entitled COVID-19 Conversations. Hey family, we brought in a few professionals from across this great nation that are going to share their experiences with you in battling this pandemic. Family, before we get into tonight's event, I have to share a few statistics with you. There have been over 1 million COVID-19 cases in the United States of America, over 68,000 deaths. And you know what? The African American community makes up about 28% of those cases. So family, I ask that you sit back, that you like, you share, you comment on the event tonight and see how it's going to benefit you. I'll catch you in the comments.
Welcome HBWC Nation. I'm so excited today to bring you Girl Talk. We thought that it was important as a nursing profession, as a respiratory profession, to talk to you about COVID-19 among Black Americans. I am Lady Felicia. I am a registered nurse, BSN. I have been one since 2004. I have done a variety of positions. I have been a charge nurse. I have been just regular nurse on the floor. I have also been a director of nursing in a nursing home. So today, along with my colleagues, we want to bring you awareness of the COVID-19 among the Black community. For some reason, other people do not want us to talk about the Black community, but we found it necessary to bring out important facts about COVID-19. However, as a disclaimer, we cannot bring up specific or particular persons that have COVID. We cannot even allude to any facility. So therefore, we're not getting any monies for this. We are not representing any facilities. So I do have to say that on the front side. We are taking a risk for even doing this, and I just want to thank my not only beautiful panel, but smart panel that I have up here. I want to introduce you to Terica.
Thank you, Lady Felicia. So as she said, my name is Terica Ward. I am a nurse practitioner. Prior to becoming a nurse practitioner, I worked in the surgical trauma ICU as a registered nurse, and then now I'm currently working in the CVICU, or the cardiovascular ICU unit, where we're kind of trending and managing all of these COVID patients.
And then we have Alexis.
Hello, my name is Alexis Pope. I have been a respiratory therapist for 11 years. I have my Master's of Science degree in respiratory therapy, along with specialties in adult critical care as well as neonatal pediatric.
And now, last but definitely not least, we have Shalandra.
My name is Shalandra Embry. I have been a nurse for almost 18 years. My specialty is ICU, although I have worked in other various settings as house supervisor, healthcare, hospice, and that's about it.
Thank you, thank you, thank you. So as you can see, we come with experience, but we thought that it was very important to bring out COVID-19. What is COVID-19? COVID, the CO stands for corona, the VI stands for virus, the D stands for disease. 19 stands, this was developed or originated in Wuhan, China in 2019. So that is the abbreviated term for COVID-19. So now we will have some statistics.
All right, so I know a lot of questions have been circulating, and we're here for Girl Talk, and so the main topic of, or one of the main topics of discussion has been, you know, why the Black community? Why are we seeing increased rate? Why are we seeing these high numbers amongst the Black people? And so I found a graph that was posted by New York Health, maybe at the beginning of April. They kind of discussed and broke it down. I really liked the way they broke it down as far as like the numbers for African Americans, the numbers of fatal Americans being affected by COVID-19. And so with this graph, it shows non-hospitalized, non-fatal hospitalized, and known deaths from the COVID-19. And if you look, the very top is your African American group. And so under the non-hospitalized, you have your percent of African Americans, and then under your non-fatal, you have your percent. And then under the known to have died, you have a certain percent of African Americans that have been affected from COVID. And so with all that being said, if you could just see just from the graph solely by itself, African American, Black Americans are leading in every single category. And so according to the CDC, in 2018, African Americans were the leading number of poverty. We were leading like 22% versus 9% with white Americans. And so then the question becomes, again, why? Why the African American culture? Why the Black people? And just to kind of clear some things up, just because, you know, people are talking and you hear a lot of people say, like, is it just because we're Black? Is it just targeted towards the Black Americans? And it's not. A lot of things that we're seeing in the hospital, and just from research-based, COVID is new. Everybody is still researching. Everybody is still trying to find the answers, find medicines and antivirals for this terrible virus. But one of the big reasons is Black people are more likely to be exposed. And that's according to research. So it's not just like in your New York places, your California areas. All across the globe, they took numbers, and Black people were more likely to be exposed. And so they accounted that for the jobs. So you have most of your essential workers, or your workers that's keeping the government functioning, are your Black people. And they're working in areas such as caregivers, being a cashier, your sanitation workers, your mailman, mailwoman. And then after a long day, they're taking these public transits home. So then here we are being exposed at every level, and then you're having to go home and take care of yourself, only to come back in 24 hours, 12 hours to do it all over again. So according to research in the CDC, they're saying that we're more likely to be exposed. Second reason is our comorbidities, our underlying health conditions, our health issues, and that's with your hypertensions, your diabetes, your COPD, your obesity. According to the American Heart Association, African Americans were leading like with high blood pressure by 40%. 40%. And a lot of people may not know that, and that's another thing. There's a lack of knowledge, there's a lack of understanding in our community. So when there's a lack of knowledge, a lack of education, we're not getting it, we don't know. Which leads me to my third point. They're saying that the third reason is because of the lack of medical accessibility, whether it's being inadequate insurance, not being able to travel to certain clinics or hospital in your area, or simply being, and I see this a lot all the time, just the fear of going to the doctor. You know, we, as Black people, we have this fear of waiting too late to go to the doctor. And so those are my three like main issues, or not issues, but like reasons that we're seeing these higher numbers in African Americans.
Wow, that's staggering because of the economic disparities. It's actually, what I found amazing was that this was actually on the CDC website. So everything that you see or hear today is public accessible. It is on the CDC website. So you can go and look at these disparities amongst the Black community, and it actually says that. Alexis, what about the respiratory end? I have Alexis Pope, who has a master's in respiratory therapy. What are you noticing about respiratory-wise about the Black community?
I think the biggest thing in the Black community, respiratory-wise, happens to be, as Terica has already mentioned, lack of education. Black people wait a little longer to seek help or medical attention. Not only that, but just a lack of understanding as far as what you're dealing with. They're recommending that we wear masks, and I think there's a common misconception of the reason why we're wearing the mask.
Okay.
Particle size and airborne versus droplet precautions. It's been this virus, COVID-19, has been compared oftentimes to the flu.
Okay.
And the flu, if you're hospitalized with the flu, you're on droplet precautions. And that's just a simple surgical mask. And the surgical mask filters whatever the patient talks, coughs, breathes, sneezes out. With COVID-19, particle size is one of the things that is not fully understood. COVID-19, the particle sizes or vessels for transmission are a lot smaller. So flu particles are larger, COVID-19 particles are a lot smaller. So you do need that N95 or a higher quality mask to filter the particles. Not only that, but also things we don't think about, environmental factors. High wind days. If somebody who's infected with the flu or COVID-19 is outside, coughs, sneezes, their particles are released into the air. If the wind is high, it travels.
Wow.
Smaller particles travel further. They last longer. It lives longer in the air. So that's something too, respiratory-wise, that we're seeing. Seeking help when you already have decompensated to the point where your respiratory system is already compromised. You've already gone into respiratory failure at this point, or you're not getting the proper amount of oxygen to support your body anymore. So once you do seek help, we intervene how we must, but are we seeking help too late?
Wow, that's good. So some of the signs and symptoms, and you all can, that we need to mention are cough, sneezing. Other signs and symptoms are respiratory failure, compromise. We talked about the comorbidities of diabetes, hypertension, some of that. All of that plays a factor in developing or acquiring the COVID-19. What are some of the other signs and symptoms that I did not mention? Because I know it affects populations differently. The thing about this disease is that it may affect someone different than the person next to you. Someone could have kidney failure. Someone could lose access of their limbs or walking. There is a lot of things are unknown, but the signs and symptoms are still there, as Alexis brought out. Signs and symptoms of the flu. You would think you just have a little cough. But if that cough is persistent, if you're running a fever, if you're sneezing, if you're having chest pain, and then one of the things that I found interesting was a loss of taste and a loss of smell. Most people don't know that. So any other symptoms that I failed to mention? Because we want to bring awareness. This is what this is all about.
Some people have abdominal discomfort where they may see some diarrhea, and like you say, the coughing. But I think one of the most important things is just you can even be affected with COVID-19 and not even be aware of it.
Exactly.
Because the incubation period.
Yeah.
There's a 1 to 14-day incubation period for that, and you wouldn't even know that you actually had it. They say usually the signs and symptoms, may vary between 5 to 6 days, but it can take up to 14 days. So you can actually be around someone, talking to someone, and not even know that you're actually affected with the disease. So that's very important. That's why they emphasize, social distancing and wearing the mask, because you can be affected and not necessarily know that you are. So you're not only protecting yourself, but you're protecting the spread of the disease.
And I
Yeah.
think that's important. I am so sorry.
Oh, you're
I think that's important, the wearing of the mask, and our nurse practitioner over here, she's gonna talk about the different types of masks and why are we even wearing masks? Because some people you see don't wear masks. So I want you to elaborate on that.
Yeah, I think it's just kind of the people that you see not wearing masks. It's like a personal choice, probably. But now the CDC comes out with new information. I feel like every week, as far as like every day, as far as what mask you should wear. Should you even be wearing masks? But now they're saying just a simple, basic face mask out in public is doable, is what you should be wearing. Now in the hospitals, your healthcare workers or your hospital personnel are wearing, of course, like your N95s or your face shields. I know respiratory therapists are like more protected because they're dealing firsthand with these patients, and even some of your hospitalists and providers. So yeah, just your basic your basic surgical mask, your N95 mask, and then as far as healthcare personnel, we're wearing the face shields, or I like to call them what do you call it, like the astronaut, the PAPR. Yeah, it reminds me like an astronaut, but the PAPR shields when we're actually one-to-one with these patients. So
I just want to elaborate. I don't think a lot of people understand why we wear a face shield. And the reason is because COVID-19 particles, the virus itself, is so small that it can be transmitted through even your tear ducts. It can enter through the eye.
Yes.
Conjunctivitis is one of the signs. It's recently released from the CDC as being one of the signs and symptoms of COVID-19. So the face shield is there to actually protect your eyes. If you come in contact with a COVID-19 patient and they cough, the particles are so small that if it enters your eye just through room air, then you can be infected with COVID-19. So that's one of the major reasons why I know a lot of people ask me, or I've been questioned as to why do you wear that face shield? That's the reason why.
yeah, I think that's good.
That's
I was
good.
going to ask also, I mean, I guess you can elaborate on this a little more. A lot of people are questioning, if I'm not sick, then why should I wear the mask? Or if I'm with symptoms, if I'm coughing, should I wear it? If I'm not, if I feel fine, should I not wear it?
So you should wear your mask. The reason is because even if you're not sick or showing signs or symptoms, you may be a carrier of COVID-19. So really the mask, especially the surgical mask or just a cloth mask that we wear over our face, is not protecting the people from, it's us protecting people from what we may be carrying, basically. It's not any form of protection otherwise, because if you cough hard enough, you're going to spew particles everywhere, and you just release your germs or virus into the air, but it's really protecting everybody else from what you may have, not knowing.
And I think that's important. One of the signs and symptoms that I did forget was hand washing. So if you cough or sneeze in your hand, you need to wash your hands, as with everything we do. Hand washing is probably the most important thing that you can do, and cleaning your surroundings when you cough. As Alexis, as Terica, as they said, this is particles in the air. So the air particles travel. So hand washing, if you cough in your hands, that's why you see people coughing in their arms, or in your coat or on the side. If you cough in your hand, because we want you to cover your mouth. We do. There are certain populations that I have seen, that I have worked with, that do not cover their mouths when they cough or sneeze. If someone covers their mouth, that's why the social distance of 6 feet is important, because of the particles traveling.
And I just want to piggyback on other ways that you can be infected with COVID-19 besides the coughing and the sneezing. You can get it by touch. Also touching different surfaces, doorknobs, putting your hands in your face. All those are ways that the COVID-19 virus can travel. So that's why it's so important to make sure that we wash our hands, because we're touching so many objects with our hands, and those are ways that the virus is being spread as well, with the coughing
Yes.
as well as the sneezing.
I know one big thing, or a lot of questions that I get is, I feel like I'm too young to get this disease. I'm 30, I'm healthy, I eat healthy, it's not gonna affect me, and that's not true. I mean, it can affect all ages. Granted, their research is saying being 10 and under it really doesn't affect you, but it does. And I mean, I've had a patient come in that's 30 years old, no medical history, no comorbidities or anything, and came in initially on life support, multi-organ failure, heart sick, lung sick. I mean, not a diabetic, come in with blood sugars at 500 and 600s, through the roof. And so that's how serious COVID is. So it's not necessarily just targeted towards your, underlying health issue, people. It's serious. And like I said, this person was young, no issues at all, healthy, exercise. So it's just a matter of, just taking care of yourself and doing all the things to prevent.
I think you brought out an interesting point, because when this first started, did y'all hear the rumor about it does not affect the African American population?
Yeah.
I was devastated when I saw these statistics. It's so heartbreaking to know that it did affect us. And when it first came out, I think I went a little overboard with my family. I was like, okay, you wear a mask. Y'all are wearing masks. I have two daughters, one a teenager and one is a young adult. And I was like, hey, we had homemade masks that someone made for us. And I was like, hey, put them in the center of your car. When you get out, put them on. But as I realized the importance of that, because it was not supposedly targeted for us. Right. And then I see the statistics, and my heart just breaks that we are affected more than any other population. It hurts me. So this is what the purpose of this is for. It is for the information so that you will know. I don't want to lose another loved one, another friend, another family. We have lost so many people already due to this virus. That's why I thought it was important to bring this out. Because at first they were like, it's not targeted toward us. And we found that statistically, as she brought up, that is not true. In fact, one statistic I found out was from the CDC, and this was April the 29th. And it says among 305 patients hospitalized, that 53% were African Americans. And I was just so hurt.
And if you think about it, African Americans only make up 13 to 15%.
Exactly.
And so with these high numbers of 50%, and we only make up 13 to 15% of the population, that's big. That's a lot.
That's a lot. Oh my God. I'm gonna have to get myself together, because, that was the rumor. And we want to bring awareness and let you know you must wear a mask. You must practice social distancing. You must wash your hands. You must do these things. You have to. And when you elaborate on, I think, the fear is real. Mm-hmm. It's real for us. When we walk and do our job every single day, the fear is there. People are looking at you sideways with your mask on in Kroger's and everywhere you go, the different places that you go, that you're going to get your necessary items that you need for your household. And they're looking at you like, why do you have on a mask? Yeah. And I'm like, really, why shouldn't I have on a mask? So I want to dispel that rumor that we are not targets. Yes, we are. But awareness is where we can help each other. Teaching is where we can help each other. So I want you to talk about the fear about your son at one point.
Well, fear is very much real, especially being a healthcare worker, as you mentioned. My children, they always say, "Mom, you're going overboard. You're doing too much." But with me having an asthmatic son, I tend to want to go overboard and make sure that I take the necessary precautions to protect him as well because he's asthmatic. And being asthmatic is one of the, comorbidities with this COVID virus. So fear is very much real. As being a healthcare worker, we go to work, as you say. People look at us funny. They look at us like we're on I don't know on a different planet than they are. But we have to take those extra precautions to protect ourselves. And like you say, the fear sinks in, especially being a healthcare worker. It does sink in. You go to work, you don't know if if someone has it or if they don't have it. You're taking care of patients that possibly can have it, but you don't know that.
Right.
Because you know as well as I know, we're not necessarily testing everybody.
Exactly.
So that's a big fear. And for a long time, there was many facilities that wasn't even requiring their workers to even wear a mask.
Exactly.
And I didn't quite understand that, but those were the type of things that were going on. So.
I want to speak from a perspective of personal fear. Just when all this COVID-19 stuff started, I think a lot of the healthcare professionals weren't really taking the proper precautions. And we were all wearing our surgical masks, but not really the N95. It is not, there's not a patient's room that I enter now without my N95. Yeah. The reason being because I guess shortly after the social distancing started, I was headed to work and got a phone call. And the phone call was, you've been exposed to 2 people without proper protection. So for the next 14 days, we need you to check your temp and make sure that you don't show any signs or symptoms. I had on a level 1, a surgical mask, but just the fear of knowing that, incubation period is up to 14 days. So day 13, I could exhibit signs or symptoms. That's pretty scary. Yes. So I took my own personal precautions, but now it's kind of throughout hospital-wide that before you enter any patient's room, you should be well protected. But it was a personal thing for me at first. Oh, yeah. And that's it. It opens your eyes to a lot of things because you don't know. You could be exposed to a more advanced or a heavier strand of COVID. I don't know how that works, but some strands tend to be stronger than others. Some people just have body aches and chills, while others it's fatal. Yeah. So you don't know what strand you've been exposed to. You just know you were exposed. So that was a personal fear, and still is, honestly.
That's good, because one of the signs and symptoms that I did not mention was chills, and you brought that out in reference to chills. I have thoroughly enjoyed today. We hope that we enlighten you in the community on the signs and symptoms. If you have to ask us questions, you can ask us questions. We are not doctors, but we are bringing you this information on behalf of nurses, nurse practitioners, respiratory therapists, our experiences. So one of the things that you can do is protect yourselves. Don't think that you're going overboard. Protect yourselves. If anyone want to close with any suggestions or recommendations, that's perfect.
Well, we do have a couple of questions, and one of them is there anything that can be done at home to build up your immunity to COVID-19?
That's a good question. Terica, I want to tell you what I do, but
I think that's good.
I take vitamins, and my husband, he takes vitamins. He used to take vitamins all the time. I think now, I take them now every day. I take vitamin D. I've heard echinacea. I take vitamin C to build up my immune system. Are there other vitamins that you take? Vitamin B?
Yeah, no, that's good. Your vitamin D's and C's. I like turmeric. Turmeric is good. Um, elderberry. I've heard a lot of people say elderberry.
Elderberry.
I'm a sea moss girl, so I love sea moss has like over 94 minerals in it, and so I usually do a lot of sea moss. So you could do that. Just eating healthy, eating better, exercising, for sure.
Drinking water,
Drink your water.
because that flushes out impurities.
This is true.
So that's the importance of water.
I actually have a routine that I do when I get home. I actually do the warm lemon and water.
Okay.
Because of the acidity. So I do that because, at one time there was information stating that, the lemon with acidic, will force the virus to go in your stomach.
Yeah.
And because of the acids that possibly kill it.
Yeah.
I don't know if there was any truth to all of that, but those were some of the things that they suggested that you do.
Okay.
The warm lemon water. So I actually drink warm lemon water.
Warm lemon
Because
water.
they were saying that the pH it was higher, so yeah, I think that's good with the lemon water and stuff.
That's good. And we also have the water with the 9.5 pH here. So it's very important. The sea moss is important. All of these preventive measures are important. Washing your hands, covering your mouths, everything is important. So any other things you want to elaborate on, Alexis, with that, respiratory-wise?
Respiratory-wise, I think if you can socially distance still, you should. I understand that things have opened up, but just because they're open doesn't really mean we have to be out mixing and mingling. And so, especially if you're immunocompromised or there's any factors that might put you at greater risk, if you have to go out, wear your mask.
Wear your mask.
Wear your mask. Yes, wear your mask. And if they look at you strange, who cares? Wear your mask because you're protecting you. No, I say this all the time, and I say this to my family. I say this to the church. No one can protect you more than you yourself. Don't expect anyone else to do it. You have to take the necessary precautions to protect yourself.
I think there was one question that I know that possibly been asked a lot, especially being with the African American, in the African American community is possibly with the high death rates of African Americans, why do we think it is, other than the comorbidities that we talked about? I know just speaking in general with a lot of African Americans, they're actually terrified to actually go to the hospital. So I think that's a big concern with the African American communities is, once you get to the hospital, because of the comorbidities that they've already not labeled, but we've already have the diagnoses that we have, such as the hypertension, the diabetes, the cardiovascular diseases. With the healthcare workers and the doctors caring for us, is there a sense of them already pushing us to the side, being that we're Black with those comorbidities? So that's a big topic in the African American community. I'm trying to say it in a very professional way. So.
Yeah, I think fear, I see that a lot, just fear of going to the doctor. And not even just for this whole COVID-19, with these people that have underlying issues, chronic diseases, I feel like either they're not going to the doctor, they're not able to get to the doctor. So that alone by itself is, you're not able to take care of those chronic issues. And then you put COVID or coronavirus on top of that, then you kind of run into some other issues. But in the same sense, I do feel us as an African American community should be more acceptable to information and not just stick with what you know, or Big Mama said this or Big Mama said that. Be more willing to accept, what you hear or what you don't hear. Jump online, do the reading for yourself, do the research for yourself. Because I know as African Americans, our faith in God and our trust in God is at the center, so we get that. But you have these people out here saying, oh, we plead the blood and the blood is covering us. You can plead the blood all day and not be saved and die and go to hell. So it's more to it. It's more to, oh, we're just gonna plead the blood. God gives us wisdom. God gives us common sense. So I feel like we should be more acceptable to this virus, to the information that's been given to us, whether it's professionally or if it's something online that you read it. Do your research for yourself. I mean, we have all this downtime, so do your research.
I just wanted to say, in researching, make sure you're researching credible sources.
True.
Yes.
That's a big thing.
True.
It's easy to enter something in Google and get a million results,
Yeah.
but CDC,
The CDC
Department of
is the
Public
best.
Health,
Yes.
World Health Organization, places
Yes.
like that are credible and give you facts and not just put together information.
This is true.
And I think the public health also gives you the ratios. It gives you the statistics as far as who has it in your community. It breaks it down by the areas. So that, like I said, is public information for everyone. Most of us have smartphones. Use your phone. Google CDC, Department of Health, World Health Organization. Do it. It's you that you're trying to protect, and your family, as well as your loved ones, your friends. So share the information. Do not be afraid to call someone and say, if you see someone not covering their mouths or not washing their hands, don't be afraid to say it. Say it. That's what we're all here for today, is to help each and every one of us. I have learned something. I'm learning now, even as this. No one knows the exact answers for everything, but what we do know, we need to share.
Another question that we have is about kids returning back to school. What kind of precautions should be taken, and what are the concerns or major concerns about kids returning back to school?
I think one of the major concerns with that is the close proximity to other. There are 30 kids in some classrooms, and they're sitting right next to us. However, statistics have shown that children are not getting the COVID-19, which I don't know if their immune system is stronger, but children are not acquiring the COVID-19.
Yeah, that's what they're saying. They've thrown an age limit out, like 10 and under, but and that's not for every child, because you see these children that's age 5 and 8, and like Shalandra said in Chicago about the kid that's getting it. So it's not, predicated to every child, but they're not seeing high rates in children. So with the concern of going back to school, I think it just kind of all depends on our numbers in this whole curve and kind of where we are within each community or each county. So I think it kind of depends on what the numbers are doing. So yeah.
So that's why the numbers are so important. That's why you need to know what is going on in your area.
Speaking of, does anyone know the numbers here, like in Houston County and Bibb County, as far as like the rate of affection rate of COVID?
I know the last data that I looked at, Houston County showed it was 215 cases with about 13 deaths. But that was the recent data that is shown.
And I looked recently, and I think Bibb County was in the 300.
300. I think it was like 309, 310, somewhere 318, something like that. Yeah, I'm not really sure the exact number, but I do know that Bibb County had the highest number of all the Middle Georgia area.
So is Albany, I guess, still leading with this whole? I know at one point Albany was
Yes.
like,
Yes, and I think next is Bibb County. Yes.
okay, so it's close.
Another question we have is, when is flu season with regard to phase 2?
October.
So it has
Usually flu season.
flu season.
October to March.
Mhm.
31st is usually flu
So I know that they've been predicting a second and third wave of COVID. So do you ladies know anything about that, or when it should be expected, or?
Here's the thing, I've spoken to a couple infectious disease doctors just to get their take on the whole, because you hear like, oh, the peak is going to be this week, or the peak is going to be this time during next month, and both of them kind of said the same thing, like nobody really knows, it's just kind of what they expect, because even with our peak season that we were supposed to have in like between Houston County and Macon and Bibb County, we weren't seeing those numbers jump up within the hospital, but they were seeing some, it was just kind of all around us. So I think it's just, nobody really knows. It's just kind of what we're predicting.
Okay. Any other questions?
From your perspectives as nurses, the immuno drug that everybody's been hyping up, have you guys seen any positive results with that?
Okay, so there's a few different ones. They recently just came out with an antiviral. It's like remdesivir or something.
Yes.
A lot of the intensivists, they're just hyping it up. They think it's just a hype. Some other things that they're using is like, they call it like convalescence plasma, or your Plaquenil in combination with your azithromycin. But again, it's just trial and error. Everybody is trying to experience and get the best results from, person to person. So I think it varies case by case. But with these patients, we are seeing that supportive care is basically the best, like just supportive care. They're coming in, because I work in ICU, they're coming in having to be on the ventilator and, needing other support, needing to rest their kidneys, so their kidneys are shutting down, they're having to be placed on dialysis. So things like the ventilator, resting their lungs, resting their kidneys, filtering their kidneys, and just supportive care, really.
That's why that's so important of going to the hospital, because this disease affects multi-systems. It's not just one system it is affecting. It affects your kidneys, it affects your lungs, it can affect your heart, which pretty much affects your whole body, you will start feeling it in your legs and your arms. So that's the importance of going to the doctor.
And I just want to piggyback off of what you said, the vent support. It's important to intervene as early as possible. When you feel like you cannot maintain at home, go seek medical attention, because the goal is to keep you off the ventilator. We want to try to stop the respiratory failure, because once you're on that ventilator, it's tough because of what COVID does to the body and the secretions that are produced in the lungs. It's a lot tougher to get you off the ventilator than it is that we can work ahead of things to try to prevent you from going on.
Yeah, that's good, Alexis, because what she said about the secretion, so you have your patient that's at home, or you have this person that's at home, they're experiencing symptoms, they start out with a cough, they start out with fevers, and then it kind of advance, and then you're seeing where they go from cough to fevers, and then they develop pneumonia with these secretions, and then they develop ARDS, which is acute respiratory distress syndrome, and then once they kind of get to that point, they are having to go on life support or a ventilator. So if you're having these symptoms and you're at home and people, are confused and wondering what should they do as far as, I don't want to go and infect other people, stay at home, go to your local CVS or Walgreens and, get your over-the-counter medicines. There was question about, should I get ibuprofen? Should I use Tylenol? And the reason why that has been in question since this whole outbreak of COVID-19 is because of the how ibuprofen is affecting the kidneys. So I wouldn't recommend using the ibuprofen. I would, if you feel like you have fever, if you're feeling pain, use Tylenol, because what's happening is you're already diagnosed with, or you've already developed COVID. COVID shuts down your kidneys, and so ibuprofen is metabolized in the kidneys versus a Tylenol where it's metabolized in your liver. So they're saying go to the Tylenol before you do ibuprofen. And then again, you know, COVID is also comes in many ways. It affects your GI system, your diarrhea, and your vomiting. So if you're using the ibuprofen, it affects your gut too. So, you know, go with your Tylenols, your over-the-counter medications, your, you know, cough suppressants, things like that. But like Lexa said, don't wait too late. You know,
Yeah, because when you see it's not working, it's time to go to the hospital. If the Tylenol is not bringing your fever down, it's time to go to the hospital.
From a respiratory aspect, somebody might just ask, well, what's waiting too late? My personal opinion, the cough may be normal. You might have a cough. But if
Seasonal
you-
allergies.
Right. If you realize that you are short of breath and you're not doing anything, you're not up and moving, you're not active whatsoever, but you cannot catch your breath, it's time to go. It's time to seek medical attention.
That's good.
that is good.
That's good. I enjoyed this. I'm so happy. I'm so excited that we were able to bring you information on behalf of HBWC Nation and nurses and respiratory therapists and nurse practitioner. I'm excited to have this wonderful, not only beautiful panel, but smart panel. So we are still available for any questions. So if you have any questions, just please let us know. We have thoroughly enjoyed today, and we want to say thank you for tuning in with us. We enjoyed you, as I hope that we have provided some information or some fact that you did not know that you are now more aware of. So on behalf of Girl Chat, we say thank you.
Thank you. And
Thank
thank
you.
you, Lady Felicia, for having us.
Yes, thank you.
Oh, thank you.